Hello, welcome everyone. My name is Trina Becker and this is Beth Bergstrom, and we are your speech therapy PD presenters for tonight's epic case study on non-symbolic AAC communicators. Before we get started with the presentation, I have a few items to alert you to. This course is 60 minutes and will be offered for 0.1 ASHA CEUs. Our financial disclosures for this evening include intellectual property rights and royalties from products sold on B&B SLP Teachers Pay Teachers store and our bboutique.slp website. We do not have any relevant non-financial relationships to tonight's content. If you have questions throughout the presentation, please put them in the chat box and we are going to address them at the end of the presentation. And that concludes our introductory material. As I mentioned, I'm Trina Becker and this is Beth Bergstrom, and we both teach at Eastern Illinois University, where we're instructors and clinical supervisors in the Department of Communication Disorders and Sciences. We both love to share our passion about our profession through presentations, social media, and through creating resources for SLPs. Tonight, we will be presenting an epic case study on non-symbolic AAC communicators. So before I say anything else, we're ready to go.
We are ready. All right, hoping everybody can see. I just saw someone commented that they have the completed worksheet. So you can follow along. There'll be some notes on the worksheet that will go along with our presentation tonight, but definitely we'll have more detail here in our PowerPoint presentation. There we go. Our learning objectives for tonight are to critically analyze case history and other information to determine the etiology. So we are going to be spending some time talking about etiology and underlying factors and how that is going to impact our decisions for clinical goals. We're going to develop a profile of strengths, needs, and functional impact to determine treatment priorities. And we're going to also determine most effective treatment approach using client values, clinical judgment, and that last thing that it said, research. This is that worksheet that you have that we did fill out for you that you can follow along. We based this worksheet off of ASHA's ICF framework. We really like the way it kind of forces you to think about a client as a whole person while considering their strengths and also thinking about their main impact areas. Our topic tonight is AAC non-symbolic communicators. Our client is Hunter. He is 8 years, 5 months. And we're going to be talking about him kind of where he is right now. We're going to be looking back in his case history and thinking about etiology. In fact, as we kind of went through this case this week in preparing, I've been working with Hunter for the last couple of semesters, but we found some things in his case history that we actually had not really considered for a while. So it was really a nice refresher to go back through his case history and consider that etiology and why he might be struggling with certain difficulties in using his AAC device. The main complaint from his mom is, he still doesn't have a reliable way to express his wants and needs. And also, we're going to be talking about a client who has some medical issues. And so she really highlights the fact that she would like him to be able to express his pain. Looking here at etiology, Hunter is a level 3 ASD client. He's characterized by significant deficits in cognitive and adaptive functioning. He has what I would classify as severe, profound, expressive, and receptive language secondary to that ASD. There are concerns that he has some absent seizures. However, he does not cooperate with any testing to determine that, but we want to keep that in mind for prognosis. He was born with cervical dystonia. He has a mitochondrial dysfunction, which results in significant gastrointestinal issues, poor growth, loss of muscle coordination and weakness, neurological problems, also some chronic sensory dysregulation. So this is that one spot where we really dug into the mitochondrial dysfunction more than probably we had before as we were considering him. And it really kind of explained some of the issues that he was having with the device, specifically with muscle coordination and weakness that we really had never pinpointed or talked about we have been kind of helping him and supporting him with those things, but we were not clear as to why he was struggling with that. So that was really important to go back into the chart and kind of consider those things. Other professionals that he's had in the past, early intervention services when he was 0 to 3, including developmental, occupational, and speech therapy. He currently receives OT and speech therapy at school. He is in a self-contained classroom in a life skills school. He receives speech therapy at the university clinic twice a week. They trialed this summer some reflex integration therapy. It was via teletherapy. It did not, I think the trainer there felt like his sensory dysregulation via teletherapy did not allow him to get the benefits from that. So they were going to take a break and maybe attempt that another time. He also is followed by the Medical Academy of Pediatrics and Special Needs to track his feeding and digestive issues. And he has an ongoing consultation with the dietitian. Hunter uses a touch chat app on an iPad that they have purchased on their own. And so he has that as his personal device. Some of the key findings from etiology are his ASD, of course, knowing what is secondary kind of to that diagnosis. The mitochondrial dysfunction is a very important consideration in etiology. Also kind of knowing that we might have some seizure activity and kind of keeping an eye out for that, but also thinking about how that plays into his prognosis. Global developmental delays, his chronic, we called it chronic. We were trying to think of the best way to kind of describe that, but if I had to say, oh gosh, prior to this summer semester, I would say that maybe 80% of a session, he could be displaying sensory dysregulation. That has kind of, we've reduced that time a little bit with some of the things that we worked on this summer, but it is definitely something that is happening in all environments and with all people. He also has a long history of speech and OT, and I would say that he's had fairly limited progress with that.
Do you want to talk for a second about his gastrointestinal and how much that impacts him daily?
Yes, we can tell usually right when Hunter gets off our elevator. We've kind of developed a little bit of a profile of his kind of behaviors to know whether or not he is having any gastrointestinal issues. He has a distended tummy. He only eats purees. He has kind of gas during the sessions that we know that he is having some difficulty with his stomach issues. And goodness, we all know that when our stomach hurts, we certainly don't feel like doing therapy. And he displays that, and we kind of know when that's happening. The first line of defense for any of those signs of his gastrointestinal problems are to have mom or dad take him to the bathroom. We always, when we recognize that, we say, we see you having these gastrointestinal problems, or we see that your tummy hurts. And then we say, let's go talk to mom or dad. They take him and try to take him to the bathroom. And then we kind of move on from there. But we sometimes have days where we can tell that his stomach is bothering him to the point that he cannot do therapy.
And that's been a thing since he was little.
Yes.
I mean, he's been at the clinic for a long time. They've been through lots of food allergy testing and
yeah, he's followed specifically for that. Actually, mom is a nurse, and so she's very in tune with kind of the signs and symptoms that he shows. But there's just not a whole lot that we can do when that kind of is the main issue with his dysregulation.
Okay, let's talk a little bit about assessment. How do we assess Hunter? How do we get a feel for where he's functioning and how he might benefit from AAC? So Beth and I in 2020 developed the AAC Communicator profile. And we developed that to help us figure out what type of AAC communicator that this child has the potential of becoming, with the ultimate goal that it will help us make good goals. So the AAC communicator profile looks at several skills, and we're going to try to determine if the individual is an emerging, functional, or generative communicator. So we're going to look at that now, and we can see how Hunter scores on our profile. The first area that we look at in the profile is pre-linguistic skills. And so just to kind of let you know how the scoring goes, the A column, which is red, means that the client doesn't do the skill at all, or not consistently enough to, circle it as achieved. B is with in context or with prompts, so they're really reliant on the activity or their communication partner, and C is independent. So you can see right off the bat that this first section of pre-linguistic Hunter is kind of mixed. He's got a little bit in A and a little bit in B. He's not responding very consistently to his name or communication partner attempts to communicate. He doesn't like to show, he's not showing his toys to others. However, he can make some choices. He does tell you what he, wants to play with, right? And he can show you when he doesn't want to do something non-symbolically, and show you when he likes something or he wants something, again, non-symbolic. So he's looking at it, he's gesturing towards it, you're reading his facial expressions, body language to figure that out.
And I would say that, those things take a while to recognize, identify, and kind of acknowledge that he is using some behavior non-symbolically to tell us those things. When you fill out this AAC communicator profile, we think that it's important to do it over a few sessions and also have other people's input, because we want to know how they're doing this across environments and across, other communication partners. So, we would fill this out. Our clinicians would be filling this out. We would also ask mom, have you ever seen this? Sometimes we do it initially, and then we do it as a reassessment once we know the client a little better.
The next section is symbolic skills. So we're looking at, does the client use words or picture symbols to make a protest, request, comment, answer questions, or combine symbols? So the only one that Hunter is kind of doing with support and inconsistently doing with support is making a request. So he needs lots of physical support. He needs the context to be familiar. It needs to be an activity that he's done several times. And we also use some supports on his device we're going to show you in the videos, but he can do it occasionally. Very inconsistent.
Yes.
Right? And then the final section here are the play skills. So looking at Hunter's play. Play tells us a lot about cognition, play is the context that the children learn language in. So that's an important part of the profile. So Hunter will reach for objects. He will hold objects for a short amount of time. He does explore them a little bit, but he's not using any kind of pretend play yet. He's not performing for attention, and he will include others in a routine activity. And then we have one of the most important sections for determining what AAC communicator category an individual is, and that's prognostic indicators. So you want to look at an individual's social skills, you want to look at their overall long-term cognition compared to their peers, and overall executive functions. These areas have huge impact on individuals' success with AAC. And again, we have an A, B, and C column. Hunter has significant deficits in all areas. So he's not really, reaching out to communicate. He's not very socially motivated at this point. He's not communicating for social purposes. He really just, is communicating to get something he wants or to let us know he doesn't want it.
Right.
And then cognition, he has had a lot of therapy. He's 8.5. He's, had IEPs in school for a long time. He hasn't made a lot of progress there. And part of the reason is his EFs are off. He's medically, unstable with his digestive issues and his sensory dysregulation, and that really impacts his learning. So we score this profile. Prognostic indicators are worth more points than the other skills that you saw. Those skills were 1 point each, and the prognostic indicators are 7 points. And then you'll see how that all comes together in the next slide. So in the summary table, when we looked at pre-linguistic skills, symbolic, and play, he's got 12 points in the A column, he's got 8 points in the B column, and 0 in the C. And then for the prognostic indicators, he has, that 21 should be up there in prognostic indicators. He has A for all of those. So he has 21 points in that, which really keeps him in that A and B column. And then when you're thinking about, is he emerging or functional? Hunter is primarily non-symbolic. He relies on non-symbolic communication the majority of the time to communicate. So he's still really an emerging communicator because he is not consistently using picture symbols or words to communicate. So that's his profile. He's emerging. We've had this profile since 2020. We've recently updated it, and we have added this analysis of learning section, and then we've added to the factors for AAC success. So the analysis of learning, we want to look at if children are analytic processors or they're gestalt language processors, or sometimes we just don't know. And that's kind of where we are with Hunter. He's not really using enough of vocalizations and verbalizations and showing us enough of his learning preferences to really know where he's at. Do you want to mention any more about that?
No, I think it's just important to know that we want to consider this to help us plan his goals and his intervention kind of plan. But I think for this, the biggest takeaway is, I think, response to therapy, that, it's been inconsistent with the way we've been doing it. And also his learning preferences we're just not clear on because we're just not really able to get enough language from him to really have a good foundation.
And then in the revised version of the profile, we have really expanded the factors for AAC success. So you'll see we have a section for the child, the family, and the educational setting. And if you're familiar at all with the AAC literature, this really follows the tri-focus framework where you're thinking about the child, the communication partners, and the environment. So we've considered all of these things and factors for AAC success. So looking at the child first, Hunter is mostly, again, in that far left column. His number and types of interests are limited. He doesn't have a lot of communication opportunities. He doesn't initiate communication interactions. He is sometimes motivated to communicate, and he does recognize communication is the purpose of the AAC system sometimes. Right. So we kind of put those circles in the middle of those two columns.
I couldn't commit to one or the other.
And then as far as the family is concerned, the family has had a lot of education. So we have developed what we call the WISPs, the why, how, see, practice, share approach to educating communication partners. And Beth and the students have really worked with Mom on educating her. And so I feel like this area has made a shift.
It really has.
It has been limited and it was guarded, and now it's leaning towards strong and how much knowledge Mom has about Hunter.
Yeah, I think knowledge, and she is now motivated to advocate for him in other places where she just didn't have the confidence to do that before. We have the luxury of our parents being able to watch all of our sessions from a video viewing room. And sometimes we talk to her at the end, but sometimes we even bring her in and say, we want to show you exactly what that looks like up close and personal. So, the big thing with factors for AAC success is that it cannot just be you, the SLP. You have to include parents, and they want to be included, and they want to kind of improve or increase their confidence. And then you also have to consult and collaborate with other people that are working with him. Until those things are done, it's just not going to happen. Mm-hmm. And so that kind of leads into our factors with our educational team.
So the educational team, you'll see there's a lot in that left-hand column. So we haven't had a lot of good success collaborating with them.
Yeah,
a lot. I think he's in a very stressful classroom. There's lots of kids with high needs in there. And so I think that impacts too a little bit how much time the teacher can spend with him and how much motivation maybe even she has to do it because she's just kind of overwhelmed with everything. So that's definitely a limitation, right? That his school is not quite on board with AAC because I think they're managing so many things. So that definitely is a hindrance when Hunter's not getting that support in the school and encouragement to use his AAC device. So that's something that we need to continue to work on. Yeah. I think he's changing school environments for next year, possibly. And so there may be some more opportunities there. So Hunter is classified as an emerging communicator. He's been that way since he start when he was 3.
Yeah.
At our clinic. And so we've been working, Beth has been working. He's had a couple other different supervisors in our clinic, and he just still really is at that stage of emerging, and he hasn't really embraced symbolic communication yet. And when he does it, it's very inconsistent. So it's hard to call him a symbolic communicator when he's not using it without so much support. So when Beth and I were revising the profile this past summer, Hunter was kind of our motivation for this new category, for these individuals that are kind of stuck in that emerging area for a long time, and they're making limited progress. And we need more specific goals to help really shape that non-symbolic communication to symbolic. So we wanted to expand our goal area, and we thought that this category was important. But we need to not automatically jump to this category when you are first starting to work with a client. You're only going to go to this category if you've considered their analysis of learning style and considered the factors for AAC success, and have you worked on those? So if you haven't even thought about those things, you need to revisit those things and try to do some education before you to move to this area. So when you have this chronic, that's not the right word, lack of success, what do I want to call it?
Consistent lack of, but I don't know, lack of progress. Yeah.
Where they're making minimal gains on symbolic communication, this is the category that you want to go to. So again, it should only be considered after you target those goals in emerging category without success. You've really given it a strong chance. And now you need to look more in depth at how can I expand, or what else can I do to shape these non-symbolic communication behaviors.
One more time, you might kind of tell them that the ideal is that they start out as emerging communicators, and then they become symbolic communicators, and they move to either functional or generative. So these are the kids who are stuck in emerging, and they're not ready to move to functional or generative, but we still have things to work on.
Yeah.
And so this is going to guide you on kind of those other things that you need to be considering. Also, this is the place where you're going to catch all those things that have contributed to that lack of progress.
Like cognitive limitations, his medical instability, the child has significant sensory or emotional dysregulation. That's going to interfere with their learning and their communication. And if you have a large population of AAC, or you've worked with AAC for a long time, I'm sure you're nodding your head right now, and you've probably seen and worked with a couple of these kids, and they are dealing with so much physically that it's just hard for them to get in a state where they can learn. And I think that's where we are with Hunter.
Yeah, and I think these are the kids where every time we present, someone will raise their hand and say, what about those kids that are at a lower level and they're not ready? What do we do with them? And now we have some really good starting points for you all on what you can do with those kids. Done with this one too?
Yep.
Okay. Okay, so the key findings from our assessment, our profile assessment that we did, are that Hunter is a non-symbolic communicator, primarily communicates wants and needs non-symbolically. He is an inconsistent symbolic communicator, meaning that he only communicates symbolically with substantial support, and we're talking about physical support. So we have kind of a little bit of a cueing hierarchy here that we do specifically with Hunter. These are tailored to him. So we do some support under his forearm, we do some support under his wrist, and then we move to more of a hand underhand or hand overhand to help him if he's still not able to activate the device. Remember, from the etiology, we know that he has some muscle incoordination and some muscle weakness. And so I think these physical supports are necessary for this specific client. They may not be appropriate for every client. As we were planning for this presentation, again, we were kind of talking about this whole need for physical support and his lack of muscle coordination, all of those things. And Trina said, well, have you considered other access for him besides just finger point? I have tried a stylus, and I have tried like a a hand guard that kind of has the stylus attached. We've tried key guards. We're currently using some icon blockers with him. But really that's as far as it went. And she said,
how about eye gaze? What if we try eye gaze, or what if we think about switches for him? I think there could be a way that you could support his arm if you could get Hunter to sit at a table.
which we will not do.
Right. So that impacts things. But I think I've convinced her to try some different things this fall.
And I'm super excited to try some of those things with your help. Yes.
Just because we talked about if he always needs this physical support from a communication partner, he's never going to become independent.
Right.
And he's always going to rely on somebody else. Not at all facilitating his communication, but supporting him physically because of his muscle weakness. So I think it's worth it to give something else a shot, to see what he does. So we're going to explore that.
Yeah. Maybe we'll do another case study at the end of all of this to update you with that. Also, some key findings from assessment are his dysregulation and his medical instability. Both of those things really lead to some inconsistent progress in his speech and language goals specifically. And then also, we're just not really sure what his learning style is. We just don't have enough consistent language from him to judge his true receptive kind of knowledge foundation. So the impact areas are really all of them. Right now, if you look at your worksheet, you'll see kind of all the boxes across that have a yes or a no. Everything really is checked yes for Hunter, except for reading comprehension and writing. Those are just areas that we're just not even able to address or even know the impact at this point. But auditory comprehension is impacted, oral communication is impacted, socialization is impacted. Definitely EF and those behavioral regulation and emotional regulation areas, and then also sensory. So impact is pretty wide, global for him. The impact questions to talk about and really kind of say this is where we need to be thinking is he needs to be able to express his wants, needs, and pain. That's mom's biggest concern. We can see that that's where we need to focus our attention. Sensory regulation is the first thing we have to do so that he can learn. Until he is regulated in our sessions, for 90% of the session, we're really kind of spinning our wheels. So sensory regulation is a very big need for him. Our biggest obstacle is that medical instability and his lack of sensory dysregulation or sensory regulation. Consistent and reliable modality of communication. The strengths that we have is that now that we are identifying, acknowledging, really thinking about making a kind of a big picture of what his non-symbolic communication looks like for him specifically, it's becoming a strength. We can really identify what he's trying to tell us by his dysregulated behaviors, by his, verbal, yelling or kind of high-pitched noise. You're going to get a chance to hear some of that with some videos. We can tell by his body posture. We can tell by where he stands in a room. All of those things are telling us something. And so really now that we kind of have made a glossary or dictionary of those things, it's become a strength for us. Communication to express, that all kind of goes together. And then family acceptance and education. Again, we mentioned earlier that they have kind of gotten on board. They are really wanting to make this work, and they feel that now is the time. We've got to kind of, capitalize on this. So I think that their education has really helped us and become a strength.
Okay, moving on to goals. So now that we know our needs, his strengths, it's time to figure out what goals we're going to write. So to help guide our goals, we're going to use the Guide to AAC Communicator goals that we worked on. We've recently, revised that as well in 2025, but we did start that in 2020. That, as well as the communicator profile, is on our Teachers Pay Teachers store. And the new version just got uploaded today, so we're kind of excited about that. But the Guide to AAC Communicator Goals provides a continuum of goals from beginner to advanced for both the functional and generative communicators And it also provides goals for emerging, and then this new category of the non-symbolic or inconsistent symbolic communicators. So if you see at the bottom, this is kind of a snippet of what is on the AAC Guide to Goals about this category. So non-symbolic behaviors should be productive, functional, reliable, and consistent. So you're really going to want to observe that child. You really got to play detective and figure out what are their non-symbolic behaviors. You're going to see Beth's great detective work that she did this summer with Hunter. All symbolic communication will likely be in a highly structured, routine supported activities. If you think back to the profile, that's that B column, and the skills that Hunter was doing were already in that column. So it's indicative of he's going to need that support. We can expect with these non-symbolic communicators that performance is going to be inconsistent. It's going to be inconsistent depending on what's their regulation like that day, how are they feeling that day. And if you've worked with kids with cognitive impairments, they just are a little bit more inconsistent than our more typically developing kids in their, their accuracy, excuse me, in the way that you're measuring their goals. And then we really need to think about receptive. It's going to take them quite a long time to receptively learn those picture symbols on the device. And I think that has to be acknowledged so that you're not giving up, right? Yes. They're going to need way longer than, a child that has higher cognition, a child that's regulated, a child that's got great attention, not impulsive. They're going to need more modeling. They're going to need more support learning that vocabulary. Thinking about non-symbolic, I think it's important for us to go back to development of how children learn symbolic language. And when babies are born, we need to think about their non-symbolic, right? They're not using words yet. And they are communicating. Well, they're not communicating yet, but they're reacting to things in their environment. So they're hungry, they cry. They're uncomfortable, they cry. They're startled, they cry. They do the spontaneous behavior to their internal state or to something that's in their environment. As caregivers, we're responding then to them. We're picking them up. We're comforting them. So they start to realize, oh, when I do this, this is going to happen. And their behavior starts to become intentional, right? It's no longer spontaneous. They're doing it on purpose. And then it gets more specific, and we now get some intentional communication, and we get pointing, and we get gestures, and we get facial expressions and joint attention. They're looking at something that they want. And what do? We name it. Oh, you want your bottle. Oh, you want me to pick you up? Oh, we comfort them. We are establishing meaning to their non-symbolic communication, right?
And acknowledging every behavior they have.
Yes. And that's how they learn to talk. And by 1 year, obviously, then they are talking. So now let's put this in the framework of Hunter at 8 years old. Hunter is using primarily non-symbolic communication still. So how are we going to shape that to symbolic communication? We got to go back and think about what we did as caregivers, as parents, early on. We need to start establishing meaning to his non-symbolic communication, and we need to be highly sensitive to his non-symbolic communication so that he can relate that to symbolic language.
And what did we do instead? I mean, I think in the past, he had these non-symbolic behaviors that were intentional, but we panicked and we saw them as dysregulated behavior that was not something that we could shape. And so our panic just kind of had us shut down and moving forward with what we should have been doing here. So what we have done kind of in the last 2 semesters with Hunter is we've gone back to really give meaning to this non-symbolic communication and these non-symbolic behaviors. The videos that you're going to see, my clinician labeling those things and saying those things. So now he wants to do them more often.
And I think you just weren't, you were in the emerging category. You were trying to establish symbolic communication. You were really moving toward the requesting and just not acknowledging those non-symbolic as much as now that you're doing.
Exactly.
And it's not that you did that wrong. I mean, you gave him time to learn. You realized he didn't. Okay, now we got to go back. I think as parents too, when you're not getting feedback from your little children, like if you think about when Hunter was born, they were doing this. I'm sure they were, reacting to his behaviors. They were trying to establish, meaning. They're labeling things in his environment. But when he wasn't that responsive because he's non-speaking, they kind of faded that. And then they just weren't in the habit of doing it anymore. So it's important to educate them to reignite that so they start doing that more and more.
Yeah, and they're feeling more hopeful because we're able to make progress now.
Yeah, and it's not because they're bad parents, because we would all do the same thing, right? We need the child to respond to us to continue to do it. And then they just got in the habit of taking care of his needs, and he's got a lot of them, right? And so all of that really responsiveness to non-symbolic just kind of faded a little bit.
And I definitely think there is. I've said panic a couple of times. I mean, I do think that I think parents panic too. They're feeling like there's no hope for moving to the next step. And so we're kind of reigniting that hope with all the discussion, with all of the consideration of all of the things that we can do with him.
And acknowledgement of what he is doing.
Yeah.
Yeah. Okay, we gotta go on. All right, so what are we going to target in terms of goal areas? So for these non-symbolic or inconsistent symbolic communicators, we need to continue to try to establish those foundational skills. So we're going to focus on pre-linguistic, and then we're going to have some communication goals because we're trying to get that symbolic communication going. And then we're going to continue to work on play. It's really important for Hunter to learn to play, to expand his interests, to have some leisure activities too. Like that's our goal for him. Eventually he's 8.5, right? So we really want to focus on that as well. And then we are going to really train those communication partners. When we just talked about how responsive communication partners need to be to that non-symbolic communication, it can't just be us for 20 minutes twice a week in the schools or at a university. We see him twice a week for 45 minutes. It's got to be all day, every day by all of his communication partners. So we need to really embrace communication partner training. They have to be included. So this is a snapshot from the AAC Guide to Goals of what the continuum looks like for a non-symbolic or inconsistent symbolic communicator. So you'll see here those categories I just mentioned: pre-linguistic, communication, and play. And with every goal, we have a communication partner strategy so that you know what to do to help establish that, and then you can share that with families. And just a quick word about vocabulary. I know there's been a big push for core vocabulary for a long time, but I think we need to take a step back and look at what emerging communicators, what are the first words children are saying, what's motivating for emerging communicators. There's this great article by Lobsher and Light in 2020, and they really talk about, I think we're missing the boat a little bit when we focus so much on core for these beginning communicators. So we need to really be thinking about what's going to motivate them. What can they relate to? They need to be concrete. They need to be their motivating items. They need to be age appropriate for the child. And we can definitely still embed some core in there. So, want, more, help, all done, those kind of things. But don't forget about that, their specific interests, because that's what they're going to want to talk about.
So for Hunter, these are the goals, the specific goals that we have pulled out for him to work on from that chart that you saw earlier. So in pre-linguistic, we are still working on improving sensory regulation during our sessions. We're working on demonstrating joint attention between toys that we have in the room, objects that we have in the room, the device, and a communication partner. We're really working on trying to have him respond to our cues and understand cause and effect of communication. So those are kind of our pre-linguistic areas that we're really focusing on right now. With regards to communication, we are still doing some functional vocabulary, some early language vocabulary. We have pulled some of those specifically from some collaboration that we did do with school on what they're working on. Also, we've asked mom and dad what are important words for him, and we've kind of included those. So right now, this summer, body parts came up. Of course, mom's biggest concern is pain. So we really did hit some language vocabulary with body parts this summer, but some of our core things are like and all done and more. We also are really working on him using nonverbal behavior to get attention. We spend a lot of time on talking about, oh, you came over to me, so that must mean that you're trying to get my attention. We say things like, ooh, I see you looking at the device to get my attention, that you want to tell me something. So we're really working on positioning and also just using his nonverbal to kind of get our attention. And then we respond to that and we make sure that we are acknowledging it and then also identifying it so that we can later match it to something symbolically.
I love that.
Yeah, we're also working on symbolically making requests. So we are doing some, modeling and some of our physical kind of prompting and cueing. When he does do something non-symbolically, we will match it to more new toy, whatever we might be using that day. And then also we think it's really important for parents as well as for Hunter to use some social phrases and comments and not overlook those. So at the end of every session with Hunter, we say it's time to go. We ask him where he's going to go. He says he's going to find mom or he's going to find dad. And then we say, what are you going to tell them? And we do, I love you. We do it every session. We practice it in routine and then we go out and find them and we do it with mom and dad. So just some of those really simple social phrases have a really big impact on parents. Again, we're trying to keep them motivated. And I don't know, it's kind of one of those show off things, right? They can, how we always want our kids to show off and do things. It's one of those things that I think that they like for him to be able to do in front of other people.
And you do that in errorless learning too, right?
Yes.
Like you use your icon
Blocker.
so that he only has access to those symbols.
Yes. Yeah.
So that's really, I think
Yeah.
that's a great way for him to learn and be successful with it.
And then play, we're just trying to introduce him to some new toys, but we definitely include all sensory toys. We know that those are highly motivating for him. So we make sure we kind of have a sensory diet that we know for sure what he is interested in. He's really interested in visually watching things, kind of spin. We know that he likes to kind of maneuver things in his hand. He also does like to do some vestibular stim spinning. So we also use that. So we have play, but we also make sure to include sensory within that. We do try to get him to use some of the novel objects in more intended ways with lots and lots and lots of modeling. And that kind of plays into using things in a variety of ways. We've been most successful with balls. We talk about rolling and throwing and catching and kicking and shooting. And so when he sees different items that are paired with the ball, he knows which one he's going to do. So play is very important. It actually helps him with regulation as well. So some of our methods that go along with our goals are that we want to really, like I mentioned, establish that profile of sensory preferences and any triggers across environments. And we want to get that down on paper, and we want to make sure that other people in his world are commenting on that so that we know what those look like and that we're consistent. We really want to read his cues and develop a dictionary of his non-symbolic behaviors, which I'm going to show you a little snippet of that in just a second. We want to presume meaning and intent for all of his communication and respond appropriately. If we feel like it's something where he's not feeling well or is, it is some tummy trouble, we want to respond appropriately to that. But if it's just, I don't like this, we also want to make sure that we are acknowledging that. And then we model with all modalities. We model with, sensory, we model with visuals, we model with objects, we model with the device, we model with our words, we model in all modalities. Our play, we really want to make sure this kind of goes back to making sure that we are also including sensory. We're choosing appropriate toys that are developmentally appropriate. He's 8.5, but his developmental age gives us a choice of different toys than we might think 8-year-olds would be using. Consistently acknowledge and respond to his nonverbal communication, and then promote routines to enhance social closeness. I really feel like building rapport. We have a new clinician I stay consistent, but we have a new clinician every semester, and taking the time for building trust and social closeness by acknowledging him is so
Huge,
important.
yes.
And the parents, I do have kind of an interesting story about him. This summer, Hunter was going to have a male clinician for the first time, and the parents actually contacted us and said, I don't think he's going to do well with a male. Could we switch? And I said, oh gosh, I really feel like it's a good fit. We really considered it and we think it's a good fit. Can you give us a chance? And she said, I trust you guys. We'll give it a shot. And it was such a great fit because this clinician really understood the enhanced social closeness, the build trust. He really made a strong connection, and we knew he would, and it paid off. Okay, and this is what that clinician was able to kind of develop. So as I'm reading some things on the left under methods, you can kind of start to kind of browse through some of the things on the non-symbolic communication dictionary that we made, that we are going to be sharing with school and anyone else that's going to be working with Hunter. We really, need to eventually match non-symbolic behaviors to symbolic vocabulary. So we need to choose and teach functional vocabulary receptively first. And to do that, we have to acknowledge all those modalities of communication. We want to teach them to use their nonverbal communication to get our attention, position themselves, tell us they need help. So what you see on the right is just one page out of like 4, I think, that the clinician put together from this summer. What he learned about Hunter. When Hunter is crying, what does the behavior mean? When Hunter is tense and using a repeatedly high-pitched vocalization, what does it mean? When he has relaxed vocalizations, what does he mean? So these are not all negatives. These are, what he does in a positive way and what he does as something that is telling us something more negative. If he throws a toy, if he puts toys away, he tries to get out of the room. One thing that you're going to see in the video is his positioning. If his hands are up here on the next page of this example, if his hands are up here, he's dysregulated and needs time before we attempt to do anything specific with our goals. If his hands are down, it means that he is regulated and ready to go. So this is so important. We took the behaviors that we had and again sent those home with parents and said, what else should we add? What do you see? Do you agree with this? We had an agree, disagree column, other comments, and then we combined it all at the end. And so, like I said, we have about 4 pages of behaviors that we're calling his non-symbolic communication dictionary. So
fantastic.
It's so helpful, and I just can't imagine how helpful it's going to be if he's going to be changing schools. But even if he stays where he is, they really need to understand what this is.
Okay, we gotta get to videos.
Okay, we have a few videos here that I want to show you. This is Hunter, and you can see up in the corner a little bit of what you're going to be looking for in the video. About 2 minutes here.
What if we play with some bean bags? These in our handy
So he's showing he's not feeling comfortable yet.
How about I set a timer and then you tell me if you want a new toy after this, okay?
Create opportunities. We set a timer for 5 minutes. Right
you
now,
want to play with that one?
Non-symbolic protesting to say, no, thank you. I don't want to play with it.
It's the wrong one, buddy. So not that one. Are you sure? Look, I'll give it a try. Look. Your turn. So we're gonna clean that one up. You don't want to do that one, huh?
Now he's going to try to match that to something on the device.
I don't like that.
Don't like? That's okay. We all have our toys we don't like.
Okay. So you were able to see some non-symbolic protesting. You definitely heard and saw some signs of dysregulation. We were acknowledging it right away all the time, and then we matched it to
But if we play the
Okay,
same
this
beanbags.
is now a little bit later in the session, we reintroduced the toy that he did not like, and I want you to look for some of the differences in his behaviors.
I'm gonna go. You ready? Almost. I'm gonna try it again. Woohoo! Oh, that was a good one. Good job. Very nice. Woohoo! Can you clap with me? Woohoo! Can Hunter do it? So we're not gonna clap. If you close your hands every time I try to get you to do that. I think I should stick with this one for right now.
He's using the icon blocker now to ask
one
if
do
he
you
wants
want?
more or all done.
All done.
All done? Let you choose it one more time so I can make sure. More or all done?
Hunter. Hunter.
Which
More.
one?
Hunter.
So you said more this time and all done last time. For this one,
And now
do you
he's like,
want
I'm
more
confused.
or all done? You got it.
More.
More. Good job. That one was a little tricky.
I love what he's going to do next after he starts this game again. So he does check for accuracy coming up here.
Do some more of this one. All right, are you ready? Woohoo! You got it in the first try. Almost. Woohoo! Almost. Oh no, almost. We threw it further that time. Almost. It flipped over like that. And I think you want to play this one because you put your hand out for me. You're ready for the next bag after you throw.
Okay, and again, that's because he knows the client so well that he could see the difference between I'm picking them up, I'm putting them away, that's telling me I don't want to do this right now, versus I'm putting my hand out saying, I'll take the next one for my next turn. So I think it's really important to acknowledge that. Okay, in this video, you're going to see some symbolic communication to use all done, new toy. So you're going to see the difference right away in his regulation as he's standing with his hands down. This is one of his favorite toys. You can hear a little dysregulated with the teeth grinding.
Look, we got 3 really good choices. What about if I go next? I got them all stacked up. Now what should we do? You want to say something?
Oh my gosh, I love that.
I saw you look at your device. Yes, I did.
While you look at your device, what do you want to tell me?
How about I ask you a question?
Yes, yes.
Want more or all done?
All done.
All done? Which one for all done?
New toy.
That was really good. Nice job.
Had he missed that, he would have totally missed that whole communication opportunity had he not acknowledged that he just quickly glanced at the table.
I know, so good. Okay, our last video here, and then we're going to stop for some questions, is some non-symbolic protesting, and teach him to use non-symbolic to get attention to change an activity.
What's wrong? Hmm? 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 If you want to say something, or you're having trouble figuring out what you want to play with, should we try this one again? What about if we do this one? Well, this one's a lot bigger. We can roll this one. I'm gonna roll it to you. How about I try one more toy? Going to use this one? I think so, because I heard your voice stop. I think you do want to use this one.
Well, again, just because he
I think
is
so,
really-
because I heard your voice stop, and I see you looking at the box. And you're not putting it away either. So I think Hunter wants to do this one. I feel like
And
there was
Hunter
yes
says,
or
thank you
no
so
on
much
here.
for listening to me.
Should we use this one? Yes.
Yes.
Look, we can use that.
Yes.
Yes. Good job.
Okay, so I just really love the way that you could see some examples of how acknowledging them just brings on more communication. So we're going to stop now and answer a few questions here before, it looks like we have about 5 minutes or so.
I'm trying to find him. Somebody commented that they had a client like this who only started therapy at 6 years old. They were only doing ABA prior to that. I always wondered if they would have made more gains if speech therapy had started before age 3. I feel like absolutely they would.
I think maybe there was a question about showing some specific examples of behaviors, and I hope that the video probably did that for you.
As well as that dictionary that you
Yes.
had and filled out.
Yes.
I mean, I think that was, great observation.
Yes. Okay.
2 new messages.
Got a couple of messages. Just wrapping up, I think no other real specific, let's see. What would you do for therapy in groups, preschool? Oh gosh, I mean, I feel like we do groups and we actually had a pair of kids this summer that we were doing acknowledging kind of some of the non-symbolic, but we did have 2 clinicians working with them so they could really try to keep an eye on what those behaviors might be. So, I mean, I think if you were going to do it with a group, you might need more than one person.
Yeah, and I think hopefully you would have some time individually with with those kids to figure out what their specific non-symbolic communication is, so that in a group you can quickly recognize what they're doing. So sharing that communication dictionary with the teachers,
Yes.
or just to have that on hand for yourself while you're in a group so you can quickly recognize and respond, I think would be great.
Mhm. So question, what would you do if a client stems on a silly word or their device? I think we both had this experience just
Yes.
recently.
Yes.
Mine from the summer was the client just wanted Well, I had one client do pizza and mushrooms, which was pretty silly, but I had another client that just wanted to say my turn, my turn, my
Mhm.
turn, my turn.
Mhm.
We just try to acknowledge that, what you're saying doesn't match what your actions are. So we still tried to acknowledge it. And we would sometimes say something about needing some sensory time and giving them something more appropriate
Mhm.
for sensory versus the device.
And I think first we did some investigation about, is he trying to tell us something else?
Yeah.
With this, I think that you need to do that first. And then if it becomes more of a behavior, then I think you deal with it from a behavior perspective. If they're using it, I don't know. I mean, like, don't just take their talker away, because you wouldn't that with a child. If another child was repeating the same word, what would you do? What would you do behaviorally with them?
Yeah, definitely.
I feel like we always get that question. So that is
We do.
not a uncommon thing about children repeating words on their device. And again, the detective work. Are they trying to tell us something? Are they using it because they like the way that it sounds? Because the mushroom on the pizza, that was something like, see, just like the way that sounds when he presses those buttons, because it did seem to me that you ask parents, does he particularly like mushrooms on this pizza, or have you heard them say this in a specific context? So detective work, I think, is important too.
And it's, that client happened to be a Gestalt language processor. So we had to go back and think about their learning style and what they were hearing and then how they were using it. So there's some other considerations as well.
Ooh, this is a tough question. This next one. How long do you recommend you continue to work with a student or client that is not progressing? Do you ever say they no longer qualify or are eligible for direct speech therapy services? Yes. This is tough. And this has definitely happened, I know, to me, to you as well. And I had a client like this who was in our therapy, in our clinic for multiple years, probably 8 years. We made sure through different supervisors and different perspectives that we tried everything that we could possibly think of with this client to get him to become symbolic. And this client was one that we talked about quite a bit when we developed this new category 2. And he had kind of a lot of the same things as Hunter. He was medically unstable. He had seizures. He had physical needs. He had dietary needs. And parents were dealing with that a lot of time, that communication was not the top priority when he was home. It was his health, his overall health. And it got to the point after we had tried no tech, low tech, high tech, acknowledging his non-symbolic. We did like a boot camp with his mom one summer. Let's everybody get on board. Let's only do this. And finally, we had to acknowledge that he had plateaued and he did get dismissed from speech therapy. And so what we did was we talked about all the things that he could do. And I feel like that is kind of what that dictionary that you made for Hunter, like, look at the ways he is communicating. We just need to acknowledge that now and share that with others. I will tell you professionally, it was one of the hardest things I've ever had to do. It was very emotional with that family. And I know teachers sometimes are like, how come you can, drop a kid from your caseload, but we have to continue to work with them? And what are we supposed to do because they're not communicating? And your response is going to be, well, they are communicating. Let's pay attention to the ways that they are and share with them that non-symbolic dictionary.
I think that's a great way to end. Again, I think it's the therapy for the people around them is where it comes in.
Yes.
Comes into play after that. So yeah.
Thank you for joining us tonight. Thank you all for attending. We appreciate you joining us.
Yeah. Join us on social media. We'd love to meet you.